Next chapter we'll be starting is chapter 10 in our textbook. In chapter 9 we talked about neurological conditions that show up as a result of having neurotransmitter issues or problems with the electrical activity of the brain. And in chapter 10 we're going to look at conditions that cause mental and emotional issues, many times because of abnormal transmitter activity or abnormal electrical activity in the brain. So, drug therapy for mental health and behavioral problems. In the textbook, about 26 pages, so 183 to 209, and in the ATI book, chapters 6 through 9, and then 11 and 15. Make sure you go through and read those. They're fairly short. So we're going to talk about medications for anxiety and sleep and what to teach patients for that. We are going to talk about antipsychotic drugs, although we are not going to use our textbook for that. We'll be switching over to the ATI book because the way they teach it goes more in line with how Ms. Wigger will teach the same thing in your mental health class, and it kind of leads to more continuity. We'll talk about depression and drugs to kind of change the mood, stabilize the mood. We'll talk about what to teach patient and families with those. So let's just look at what it means to be mentally healthy. Mental health is considered to be a state of well-being, and when you have good mental health, you're able to cope with the normal stresses that life throws at us all the time. We can do meaningful, productive work. We have realistic expectations of what we're able to do. We're able to get along in the community, and generally move successfully among the other people that make up our lives. Mental health is influenced by a number of different things, and our mental health can change at a lot of different times. We are not always going to be 100% mentally healthy. There are going to be times when anxiety, depression, mood swings overtake us, and that's a normal part of living. But with mental health, you usually can handle it well and kind of keep doing what you need to do. So we'll talk about those occasions when sometimes that isn't so easy and you might require some chemical help to balance out the neurotransmitters. On page 185, there's a little bit of what's a review for us on the neurotransmitters. We can see some of the main neurotransmitters, how they affect the brain, and what they can lead to as far as mental health when they are not quite working properly. So make sure, once again, you've reviewed serotonin, dopamine, norepinephrine, and epinephrine, and then GABA, as well as acetylcholine. And remember what parts they play, whether they work in sympathetic or parasympathetic, and whether they are considered excitatory or inhibitory. So the first thing we're going to talk about is insomnia. Our ability to sleep is very tied into our mental health, and studies have been done that show it does not take too many days of poor or interrupted sleep before it begins to affect our mental health. And so we're going to look at a group of drugs that function as what are known as sedative hypnotic medications. These are central nervous system suppressants or depressants. Now, a sedative will kind of make you feel relaxed and allow you to get to sleep sort of normally. You become drowsy, it reduces your anxiety, and you're able to sort of drift off to sleep. A hypnotic agent actually produces sleep. It's usually a little bit stronger, and it's going to make you sleep. These drugs are used to help relax patients and to treat insomnia. that is caused by either physical or mental stress, as well as being used in the medical setting before certain tests and surgical procedures. On page 186, we see a drug table with common medications for sleep and anxiety. In our ATI books, you can read pages 117 to 122, and that will also give you some ideas of some medications that will work to relax you and to help you sleep. Now, there are different kinds of insomnia, and you probably can relate to all of these. I think we've all experienced them at one time or another. If you get into bed and you want to try to get to sleep, but you just toss and turn and can't even get to sleep to begin with, that's known as initial insomnia. What's also common is to fall asleep fairly quickly, but then you can't stay asleep. So you wake up at some point in the night and kind of toss and turn, and then maybe fall back to sleep again. That's intermittent insomnia. There's not a whole lot of rhyme or reason to it. And then terminal insomnia is waking up very early in the morning, lying there and thinking about things and not really being able to get back to sleep. And terminal insomnia has been associated with anxiety and depression. You see that a lot in patients who are plagued by anxiety. Now, when it comes to trying to encourage sleep, we're told to try non-medical alternatives if we can. You can take a warm bath or a shower, drink something warm, although uncaffeinated, before you go to sleep. Make any adjustments to your bedding or to the temperature in the room so it can make it easier to stay comfortable. And if you try all these and they don't work, eventually the healthcare provider may prescribe meds temporarily. Now, all these meds act as central nervous system depressants, and they're going to result in drowsiness, which is great when you want to go to sleep, but if you're still drowsy the next day, it can be kind of irritating. You might feel hungover. It might sort of dull your ability to have emotional reactions, and you might just kind of walk around feeling sort of blah. Other central nervous system depressants can interact with these sedative hypnotic drugs and can produce dangerous reactions. On page 187, we see some lifespan considerations, or a lifespan consideration on page 188, but on 187 is a safety tip, and this tells about a drug flumazenil, which is used to counteract benzodiazepines like Valium or Xanax. It's important to remember that these sedative hypnotics are supposed to be only used short term, and they can be very addicting. And so it's better to try to look for underlying causes of insomnia and other ways of leading to sleep. The first drug listed on page 186, it's a category of drugs called the benzodiazepines. And you might recognize these. Benzodiazepines have AZ in the generic name. So we've got flurazepam, temazepam, and estazolam, which are considered to be drugs that are approved for sleep. And then when we talk about anxiety, we're going to look at other drugs that you might recognize more: Ativan, Valium, Xanax. These all have a sort of sedative effect and can calm a patient down.